The Health Experiences Research Group has been going for just over a decade now, and our aim is to understand what it's like for people who have particular illnesses or conditions or health choices to make, and use the results to help other people going through the same thing. In that time, we've covered around 70 different health conditions and topics and conducted around 3,000 interviews, which we now hold in our archive. We get around 5 to 8 million hits a month, depending on the month, on the website. And we've been able to use the results to inform clinicians about what it's like for people experiencing an illness, as well as to help people themselves going through the same thing. Inspiring stories of how people have overcome illness can be good and they can be helpful, and we would always want to include those people in whatever we do, but not everyone responds well to that. For some people it's more important to see somebody else talking about how bad they felt and how difficult they found it and how miserable they feel now, so that they're reassured that their response to illness is normal. Doctors have a particular role when they're talking to a patient, which is to find out what's wrong with them and to help find the right treatment. They often don't have time or space to ask them about the kind of impact it's having on their wider life, so we hope we can provide some material to help fill that gap. The project grew out of discussions between two old friends who both happened to be doctors about their own personal experience of illness, and realising that the boot was on the other foot and they knew all there was to know about the medical facts, but actually didn't know what to expect as human beings and how this was going to impact on their wider life, their family, their sense of self. And so they thought it would be interesting to try to capture stories from lots of different people about what it was like for them. They came into contact with academics who were used to doing qualitative interviews with people to find out about their experiences, and the project grew from there to become a huge award-winning programme of research. What's exciting is we're now at the stage with 70 conditions covered where we have enough information to start thinking about how we can use it for different purposes. So we really feel that the work that we've amassed has now got the potential to make a real difference to decisions that are being made at all kinds of levels, from individual patient through to the individual doctor and patient, right up to government and all levels in between. So is this the... It is amazing that something that started round a kitchen table has become something so huge and potentially so influential, with millions of people looking at it and the opportunity to influence government and the NHS. And that's really gratifying for the research team. There aren't many research jobs where you feel that you're having such a direct impact, as well as doing the usual academic things such as publishing in peer-reviewed journals and going to conferences. And I can honestly say it's the best research job I've ever had.